including Bavaria. They'll also be required in shops. Let's go to Berlin to speak to our reporter Jessica Saltz for a little bit more on this. Morning to you, Jessica. So the reproduction number has risen ever since there was a loosening of some of the restrictions in the country. Do officials seem concerned about this? I assume they are, but would that change perhaps their plans in how they want to ease restrictions so that life does eventually get back to normal?
Yes, Rosie, the reproduction rate of the virus rose to 1 earlier this week, meaning that one person can affect one other person. Now, this is seen as critical in Germany, as it is widely believed here that Germany's management of the spread of the virus is critically dependent on keeping the number below 1. And this number cannot be taken in isolation. Overall, the infection rates week on week in Germany are starting to fall. But this is a cause for concern as Angela Merkel heads in to a teleconference talk today with the heads of Germany's 16 Bundesländer to discuss the next steps in releasing lockdown measures across the country. So cold water has been poured on any hopes for any major new steps to be taken. I think the German Chancellor is very tentative of a second wave of infections, but the German government always knew that releasing lockdown measures was going to be a dance of moving a few steps forward and then perhaps having to readjust. We know that in the meeting today we're going to see Germany's travel ban officially extended to the middle of June. Social distancing measures are also going to be extended, but the leaders of the country and the federal states are going to be discussing a return to normality with a specific emphasis placed on how schools and businesses can continue to reopen safely. And as ever, testing remains absolutely of paramount importance in Germany. After a cabinet meeting yesterday, the health minister said that Germany is really going to ramp up its testing to capacity. That's 900,000 tests a week that Germany can currently do. The maximum that they've done so far has been about half of that, but the health minister said they are really going to ramp up the amount of testing to maximum. They're also going to be prioritising testing healthcare workers and also vulnerable groups, especially in care homes.